Well, as some US states begin to reopen after coronavirus lockdowns, emerging data suggests new cases have continued to drop despite the relaxation of rules. States like Georgia and Florida, which experts were concerned about back in April, haven't seen a rise in total cases. Georgia's new cases declined, in fact, by 12% compared to the previous week, and Florida's dropped by 14%. However, that's not the case for every state. South Dakota, for instance, has seen a 123% increase. And that's likely down to the outbreaks in the meat processing industry. Lots of factories up there. Dr. Maureen Miller is an infectious diseases epidemiologist. She joins me from New York. Doctor, it's great to have you with us. We've just been listening to the president in the Rose Garden. We've had some of the characteristic hyperbole of how good things is and how fast it's going. But as these states reopen this week, we've got some advice from the CDC in America as to what people should be doing. I'm wondering, though, whether they fully understand the plan.
I wonder that as well. First, thank you for having me. The plan that has been released by the CDC is more of a checklist and encourages businesses to have social distancing, but not really the detail that they need in order to make sure that people are safe. I think the leaked version, partial version, is much more effective in terms of sharing the information. But right now, it's just kind of confusion and a free-for-all. So state governments and city governments are doing the best they can with very limited information.
The reason I put that question to you is because I've been reading the editorial of one of the world's oldest medical journals, and that is The Lancet. I want to put something on screen for our viewers. This is from their editorial this week. It says the Trump administration's further erosion of the CDC will harm global cooperation in science and public health, as it is trying to do by defunding the WHO. Goes on to say the Americans must put a president in the White House come January 2021 who will understand that public health should not be guided by partisan politics. It's the feeling of the editorial board on The Lancet, Doctor, that he has marginalised the CDC to such an extent that he undermines the message.
I would absolutely agree that the CDC has been completely marginalized. Every outbreak, pandemic that has occurred in this century and before has been headed by the CDC. When the coronavirus pandemic was first coming to the U.S., Nancy Messonnier of the CDC, the director of the respiratory infection disease, came out and made a stark statement about the reality of this virus. And we've never heard from her again. So there's been really, everybody has been silenced that could have some impact, except for Dr. Fauci. And thank heavens for him. It's, we in the public health community live in fear that they're going to get rid of him.
And yet some would say on the right, the plan was never to lock down indefinitely. It was designed, the lockdown, to flatten the curve. And when you look at these states that we've just been looking at, Georgia, down 14%, Florida, these are the states that reopened in April. Something's happening. Are people perhaps paying attention to the social distancing rules? It is having an effect, and maybe we don't need to be locked down so tightly.
I have two things about that, because I think the American public, in the face of watching what was going on in Europe and suspecting strongly that it would come here, I think people were terrified and they made major behavior changes like I've never seen. And they are still nervous. But the point of having the curve flattened, and I think they did, and it is likely declining, that was due to people's actions. The second part of that, the declining cases, I just went on the Georgia State Public Health Department site, and they are very much rationing tests. So we don't know really what the state of infections is in Georgia. They're rationing to people in hospitals. They're rationing to asymptomatic people who are first responders, healthcare workers, and a very vague group called critical infrastructure workers. No one else is allowed to get tests unless they go to a private laboratory and pay for it themselves.
And also, just finally, there is a lag. We don't know what's going to happen in 2 weeks' time. But would you accept that this is going to be hugely important in the run-up to the 2020 election? Because what happens in these states, in these Republican states, over the next few weeks, the direction of travel of the infections, that is going to be jumped on if it continues to go downwards.
Absolutely, it will continue to go downwards, but one of the reasons I'm suggesting an underlying cause is that we're not testing the people who are getting infected and those infections will be simmering all summer, and then they'll come back in the fall when people have a false sense of security. I think the coronavirus will be affected by seasonality, but mostly because people will do outdoor activities. Indoor activities in crowded settings, that's where we're going to see spikes, outbreaks, and in a few weeks, that lag time before we start seeing hospitalizations.
Dr. Maureen Miller, fascinating to talk to you. Thank you for being with us.
Thank you.